Assalamu alaikum warahmatullahi wabarakatuh. Study designs. I, Dr. Muhammad Akram, Department of Eastern Medicine, Government College, University, Faisalabad. Types of primary studies. Descriptive studies. Describe occurrence of outcomes. Analytical studies. Describe association between exposures and outcome. Basic questions in analytical epidemiology are exposures and disease linked exposures and disease. Basic question in analytical epidemiology look to link exposures and diseases. What is the exposure? Who are the exposed? What are the potential health effects? What happen will you take to study the relationship between exposures and effect? Basic research designs and their application to epidemiology. Descriptive case report, case series, descriptive epidemiology. एनालिटिकल में आरसीटी, क्वाड स्टडी, केस कंट्रोल स्टडी, केस क्रॉसओवर स्टडी, क्रॉस सेक्शनल स्टडी, बिफोर आफ्टर स्टडी, इकोलॉजिकल स्टडी. Time frame of studies. Prospective studies looks forward, looks to the futures, examines futures events, follows a conditions, concern or disease into the future. In time frame of studies, retrospective studies to look back in time to study events that have already occurred. Study design sequence, hypothesis formations, case reports, case series, descriptive epidemiology, lab study, animal studies, analytical studies, clinical trials, hypothesis testing, quad, case control study, cross sectional, descriptive studies, case control studies, quad studies, clinical trials. Develop a hypothesis, investigate its relationship to outcomes, define its meaning with exposures, test link experimentally. Case reports, detailed presentation of a single case or handful of cases, generally report a new or unique finding, previous undescribed disease, unexpected link between diseases, unexpected new therapeutic effect, adverse events. Case series, experience of a group of patients with a similar diagnosis, assess prevalent disease. Cases may be identified from a single or multiple sources, generally report on new or unique conditions, may be only realistic designs for rare disease disorders. Case series, advantages, useful for hypothesis generations, informative for very rare disease with few established risk factors, characterizes averages for disorders. Disadvantage, cannot study cause and effect relationship, cannot assess disease frequency. Case report, one case of unusual finding, case series, multiple cases of finding, descriptive epidemiological study, population based cases with denominator. Analytical studies, study designs, analytical epidemiology, experimental studies, randomized controlled clinical trials, community trials, observational studies, group data, ecological, individual data, cross sectional, cohort, case control, and case crossover. Experimental studies, treatment and exposures occur in a controlled environment. Planned research designs. Clinical trials are the most well known experimental designs. Clinical trials use randomly assigned data. Community trials use non random data. Observational studies, non experimental, Observational because there is no individual interventions. Treatment and exposures occurs in a non-controlled environment. Individuals can be observed prospectively, retrospectively, or currently. Cross-sectional studies and observational designs that surveys exposures and disease status at a single point in time, a cross-section of the populations. Study only exists at this point in time. Cross-sectional designs. Study populations, no disease and disease. No disease, factor present, factor absent. Disease, factor present, factor absent. Study only exists at this point in time. Cross-sectional studies often used to study conditions that are relatively frequent with long duration of expressions, non-fatal chronic conditions. It measures prevalence, non-incidence of disease. Examples: community surveys, not suitable for studying rare or highly fatal diseases or a disease with short duration of expressions. Cross-sectional studies disadvantages. Weakest observational designs. It measures prevalence, non-incidence of disease. Prevalent cases are survivors. The temporal sequence of exposures and effect may be difficult or impossible to determine. Usually don't know when disease occurred. Rare events a problem, quickly emerging diseases a problem. Epidemiological study designs, case control studies, and observational designs comparing exposures in disease cases versus healthy controls from same population. Exposure data collected respectively, retrospectively. Most feasible designs where disease outcomes are rare. Case control studies, cases, disease, controls, no disease. Cases, factor present, factor absent. Controls, factor present, factor absent. Study populations. Case control study strength, less expensive and time consuming, efficient for studying rare diseases. Limitations: inappropriate when disease outcome for a specific exposure is not known at start of study. Exposure measurements taken after disease occurrence. Disease status can influence selection of subjects. Thank you very much.